You would take the cartridge and you would spray it under your tongue like this.
This is Subsys, a prescription opioid 50 times more powerful than heroin. For more than 2 years, Angela Cantone's doctor prescribed it to her to treat her pain from Crohn's disease.
It completely destroyed my life. I was not able to function for my family. It was a zombie-like state. I suffered for over 2 years thinking that I was dying. I made arrangements for my children if something were to happen to me.
When you told the doctor that you didn't feel very well on this medication, what did he say?
The response that I got floored me. It was opioids or nothing.
And in particular, this opioid?
Subsys, yep.
He didn't give you other alternatives?
Nope.
Cantone then learned that her doctor had received more than $200,000 from the company that makes Subsys for speaking, consulting, and other services.
The medication that was being prescribed to me was for his benefit, not my own.
As the nation's opioid epidemic rages, CNN and Drs. Anupam Jena and Michael Barnett of Harvard University's Schools of Medicine and Public Health did a new analysis of government data. This is a pretty dramatic line.
I agree.
What we found is stunning.
The big picture is that the more money a physician receives from an opioid manufacturer, the more likely they are to prescribe opioids.
As you can see here, the doctors who get paid the most money, they prescribe the most opioids.
We don't know which way that relationship goes. Is it that the payments motivated the physician to prescribe more, or did the high prescriber attract the money?
If there is the possibility that paying doctors leads to increases in inappropriate prescribing of these drugs, that's something that we have to take seriously.
We showed opioid researcher Dr. Andrew Kolodny our findings.
It shows that the drug companies are really getting what they pay for. In effect, they're almost bribing doctors to prescribe their drugs aggressively.
But pain specialist Dr. Steven Stanos says pharmaceutical companies are paying doctors to educate other doctors.
I would hope that they, choose physicians that have an understanding of the drug, are respected physicians, and can speak objectively about that.
The pharmaceutical industry told us it works to make sure patients' needs are met while also preventing overprescribing. Cantone is suing Insys, the company that makes Subsys, and her doctor for fraud. Both deny the allegations. In court documents, Insys said its product marketing conformed with industry standards, and Cantone's doctor said the medical care he gave her was reasonable and appropriate and in keeping with the standard of care. But Cantone says her doctor did overprescribe opioids for money.
I was used as a pawn in a chess game, which later ended up making him and the pharmaceutical company a ton of money.